Once a week, Jet 24 tries to bring you the latest news and updates in the fight against COVID-19. We're doing this with the help of some of the area's leading medical experts. Joining me tonight to talk about his experience with the COVID-19 pandemic is Dr. Daniel Muccio, Chief Medical Officer at AHN St. Vincent. Dr. Muccio, thanks for coming in tonight. We really appreciate it.
You're welcome.
Now, you oversee the physician response to COVID at the hospital there. What has the physician experience been like from the onset of the pandemic back in March up until now? How has that evolved?
Well, initially we were quite fearful because many of the aspects of the disease were unknown, but we were very determined to try to help both the patients and our community get through this. Over time, we learned many new policies and procedures, and then had to adjust to gigantic shifts in the volume in the hospital. First, we had to deal with canceling elective surgeries and having very few elective patients to treat, and then we had to deal with ramping back up, and now are treating almost near normal volumes of patients while at the same time taking care of patients with COVID-19 every day.
Now, I imagine, when you figure out what works and what maybe doesn't, that eases a lot of minds when you talk about the employees at the hospital, right?
Yes.
How many patients to date has St. Vincent treated, and how many are currently hospitalized?
We've treated 92 patients, and today we have 4 patients hospitalized with COVID-19.
All right, when we talk about evolving through the months since this began, how has the care provided to the patients that are hospitalized changed over the course of the pandemic?
We've learned a great deal as we've gone through the pandemic. For example, initially we were prescribing hydroxychloroquine to all the patients that we saw, but as both the research and our own experience showed us that it was not really effective, we stopped using it. We then moved on to the administration of convalescent plasma, which is giving the blood plasma of patients who've recovered to the sick patients so that they get the antibodies from the sick patients. And we joined the Mayo Clinic protocol and started a convalescent plasma program under the direction of our infectious disease expert, Nancy Weisbach.
Why do you think, I don't mean to cut you off, but why do you think we're running out of time? And I was wondering if you had a thought on why the hospitals appear to be far better equipped to handle the contain and spread within their walls than say, the nursing homes or the extended care facilities?
Well, I can't speak to what the nursing homes do, but I can speak to what we do. And first and foremost, it's been wearing masks. When we wear masks, we protect the patients from us, and we protect ourselves from each other in case any of us are carrying the disease. We wear face shields when we're dealing with the patients, and we found that eye protection can prevent the transmission of the disease from person to person. Cleanliness is key. Clean the hospital, clean your hands, and don't come to work sick. Don't come to work with a fever. Don't come to work with flu-like symptoms. If you follow all those guidelines, you can protect your staff, which will then protect your patients.
Dr. Daniel Muccio, thank you so much for coming in. I know we could talk a lot longer on this, and hopefully we can keep the conversation going very soon and bring you back. Thank you, sir.
You're welcome.
Jet 24 Action News continues next.